If you are a middle-aged woman and you start feeling warm all over, you just might be in Arizona during the summer, or you possibly may be going through menopause. Hello, my name is John Lynn. I'm a urologist in Gilbert, Arizona. I'm very, very excited to have in this program Dr. Becky Lynn, who hails from St. Louis, Missouri. She's a OBGYN and transitioning from academic medicine into private practice in a very special type of private practice that we will discuss later on. She's a sexual health expert and also OBGYN. Obviously, she treats a woman with going through menopause and all sorts of female issues, something that I don't treat. And I think a lot of my peers and colleagues, female colleagues, are going to be going through menopause, probably already are or about to. So I think this topic will be very relevant to all my female friends, as well as the husbands of the female friends, because menopause will affect not just her vaginal health, but mental health as well. So welcome, Dr. Becky Lynn, to the program.
Well, thank you so much for having me, Dr. Lynn. It's a pleasure to be here. I'm a general gynecologist, and I specialize in perimenopause, menopause, and sexual health. Sexual problems in women like low libido, painful sex. I deal with hot flashes, hormones, anxiety, depression, weight gain, all those things that make menopause miserable. But it doesn't have to be miserable because there are plenty of treatments.
So before we start, what is menopause and what happens to a woman when she goes through menopause?
Sure. So menopause is when your ovaries stop making estrogen. Basically, when your eggs run out. Your ovaries aren't making follicles anymore with eggs in them. And so those ovaries usually make estrogen, and at menopause, that goes away. You still have a little bit of estrogen around because fat cells make estrogen, but you're not making that estrogen and progesterone. And also your testosterone is pretty low at that point too. Mm-hmm. The way that a woman sees it though, is it's that last menstrual period. So a woman can say that she's actually through the menopause, has gone a full year with no menstrual period. But the symptoms of menopause start a couple years before that last menstrual period, and then they last for a couple years after. So that time before your period goes away is really the perimenopause, but you have a lot of the same symptoms as once you're through the menopause. So hot flashes, vaginal dryness, weight gain, low libido, depression, anxiety, the list goes on.
So at what age does menopause start for a woman?
Yeah. So the average age is 51. But, periods can go up to 59, but about 90% of women are having no more periods by age 55. But the average age is 51 and then goes, 40 and older. And 40 would be early.
And how long does menopause last? I know it doesn't turn off right away. So it starts sometime and then it ends at some time. How does that work?
So it usually starts maybe 2-3 years your last period and then lasts for 2 or 3 years after your last period. But for some women, it could start 7 years before and last 10 years after.
Oh my gosh.
Not as many, most people, it's kind of like a bell curve. Most people fall in that couple years before your last period, a couple years after. But then, not everybody read the book. And some people have hot flashes for 10 years after their last period.
Yikes. What are some of the things that can be done to help with some of this? Let's just pick vaginal dryness. What can a woman do when she goes through menopause with vaginal dryness?
So let me just say one thing about vaginal dryness that I think is important for women to know is that vaginal dryness tends to show up the most about 5 years after that last menstrual period. So a lot of women don't realize that the vaginal dryness is due to the lack of estrogen because, they stopped having periods 5 years ago. But that vaginal dryness often causes painful sex. It can cause discomfort with riding a bike or even walking. And it can be really uncomfortable. And the good news is there are plenty of treatments for vaginal dryness. Typically, we start with vaginal moisturizers. There are many vaginal moisturizers over the counter. You have to be a little careful because there's so many and you're the over-the-counter things aren't as regulated as prescription medicines. But I usually recommend coconut oil or even Crisco as a moisturizer, just like when you wash your hands and you put some lotion on your hands, it does the same thing. That is great for moisture, but it really doesn't make the vagina like it was premenopausally. And the only way to do that is to give vaginal hormones. And we do low dose vaginal hormones. And the good news is we all hear the word hormone and we're scared half to death when we shouldn't be. Low dose vaginal hormones do not increase the risk of breast cancer, blood clot, heart attack, or stroke. Let me repeat that. They do not increase the risk of blood clot, breast cancer, heart attack, and stroke. They're very low risk. And really what they do is they allow the vagina to grow the cells that make moisture. And they also allow the vagina to regrow things like collagen and elastin, which allow for stretchiness, because a postmenopausal vagina loses that stretchiness. And so with not being able to stretch in combination with the inability to lubricate during sex causes painful sex. And it's really easily treatable.
Well, that is wonderful to hear. When you say coconut oil, is that an external application, or you can also use it internally?
You can use it in both places. So coconut oil, it's actually solid. It's like a white solid. It almost looks like Crisco. And there's no right or wrong way to apply it. You just put some on your finger, put it wherever you feel dry. Most women will feel the most dry kind of at the opening of the vagina. But some women feel dryness inside and they'll put some on the inside. If you use too much, you'll feel greasy and yuck. And if you don't use enough, you won't notice a difference.
So those are nice over-the-counter remedies. What about prescription type things that you can provide?
Yes, so there are a variety of hormone preparations. My two favorite would probably be, there's an Estradiol Gel cap. Its trade name is Imvexi, which I think is genius marketing because it sounds like I'm sexy. Genius marketing. And there's no applicator. It's like this little tiny gel cap. You pop it into the vagina yourself. You do that every day for 2 weeks and then twice weekly thereafter. It's really convenient. You don't have to do it at night. There's no applicator to wash. There's not a disposable applicator that becomes trash. And it works really, really well. There's two strengths to it. There's a 10 microgram and a 4 microgram. And the 4 microgram is the lowest dose on the market for anyone who's really concerned about hormones. There's also a suppository of prasterone, which is DHEA. And DHEA is another hormone. It's like a cousin to estrogen and testosterone. And in the vagina, in the vaginal cell itself, it gets converted to estrogen and testosterone. And women, they make testosterone. You know, we usually think of testosterone as a male hormone, but women actually make more testosterone than they do estrogen, which I always find really interesting. They don't make as much as men make, but women do make testosterone. And the vaginal tissue actually needs some testosterone to make moisture. So that's another good one. There's also creams, estradiol, and there's Premarin cream. I think the creams work really well. They're just a little bit messier. There's a tablet that goes at the top of the vagina. There's a ring. I'm not a huge fan of those. I feel like they just don't work as well as the other ones. And then you didn't know there were so many options. Yeah. There's also, I could go on. There's also a pill that you can take if you don't like putting something directly in the vagina. There's a pill you can swallow that actually helps moisturize the vagina. It kind of acts like estrogen in the vaginal tissue.
Boy, it sounds like there are a lot of good options out there. What about some of my patients are a little bit more cost conscious? What about compounded type estrogens?
Yeah. So if there's a prescription, then it's better to use the prescription than the compounded form. And actually, Imvexi and Intrarosa are fairly cheap. So Intrarosa has been, since it came out, $35 a month. Unfortunately, women with Medicare can't get that $35 a month price, which is highly unfortunate because they're the women who need it the most. Imvexi is anywhere from $35 to $50 a month. Both of these are so much cheaper than what we had before they came out. Before that, estrogen creams were like $200.
Oh my
And so
gosh.
that was too much for many, many people. So, when we didn't have Imvexi and Interosa, then sometimes I would do compounded or, get it in other ways. Some people would drive to Canada or Mexico to get their creams. So
yeah, not surprising. Kind of like what men do with their ED medications before Viagra and Cialis became generic.
Exactly. They would drive to Mexico.
Yeah, or get it from Canada. I always say,
Canada.
You can do whatever you want to do. I simply cannot endorse you getting medication from another country. So there you go.
Right.
All right. So we addressed vaginal dryness. Boy, that was very comprehensive. So thank you. What about some of the other physical changes? The weight gain, in the mid waist area. How do you counsel women who gains weight?
Yes. So weight gain around the time of menopause is so frustrating because it's like adding insult to injury. You're already miserable. The vagina hurts. You're like sweating at night. And then all of a sudden you're now depositing fat around your middle. And your metabolism slows down around the time of menopause. So I counsel about weight loss. And really, it's not just about exercise, but it's also about caloric restriction. So, there are a couple of diets that I recommend that I think are reasonable and healthy, like Weight Watchers is a very healthy way to go. Slow as molasses weight loss, but it tends to stay off and it teaches you very healthy habits like portion control. It's not so restricting that you go off the deep end and finish everything in the refrigerator late at night when nobody's looking. And then you also have to exercise. And there's two types of exercise that are important. So part of that has to be aerobic exercise where you break a sweat, you get your heart rate up, it's cardiovascular. And then the other part that's important is building muscle, because muscle burns more calories than fat. The way that I look at it, if you have limited time, and many of us have very limited time to get to the gym, I always say go for the aerobic or cardiovascular because it speeds up your metabolism during the exercise. Your metabolism stays higher after you're done exercising, and it's a big calorie burner.
It's much more efficient.
It's what? I'm sorry?
It's much more efficient.
Oh, very efficient if you're time crunched. And one thing that I always bring up that I think is important too is women will say, but I always go to the gym. I run for 30 minutes. And so what I tell them is the first time you ran 30 minutes, you were not very efficient at it. You probably burned a whole bunch of calories and you were exhausted afterwards. But if you do it all the time, you're good at it. You're efficient. Your body's probably not burning as many calories. So at that point, it's time to change it up a bit and either go harder, go longer, start cycling, do something else to kind of kickstart your body again and make it work extra hard.
So as the body changes in a woman going through menopause, those are some of the physical changes. Can you speak to some of the mental changes, right? Men are used to dealing with the changes in mood with cycle, but as the estrogen disappears from a woman, what happens?
Yeah. So, hormones they kind of wreak havoc mentally on a lot of women. It's almost like a second puberty. Nobody wants to go through puberty again, right? It was already miserable enough. But women will be irritable, anxious. There are a lot of big life changes that occur around the time of menopause. Your children grow up, they leave the house. A woman might have had her identity as taking care of her children for the last 18 years, and all of a sudden they're gone. Now it's who am I? Where is my identity? Where do I get my self-confidence and self-esteem from? There's financial stressors. Women might be taking care of ill parents. Kids are off to college. That's another financial stressor. There's so many things that are going on that can really contribute to anxiety and depression. And women don't always know that that's very common as your hormones are changing. So they're not mentally prepared and may not really have anybody to talk to about how they're feeling. So mentally it is tough. And that's another good reason to exercise. Exercise is the best antidepressant among the many other things that it's good for. But yeah, there's some mental health issues that happen around the time of menopause.
So exercise is is one way to manage the changes in the brain.
Yes,
and
absolutely.
For those women who need it, I think there are oral medications that are efficacious, right? Some type some of the antidepressants, SSRIs, SNRIs, and maybe estrogen as well.
Yep. So estrogen really kind of levels out your hormones. So that definitely helps. It requires, discussion of the risks and benefits of being on hormones, but every medicine you take has risks and side effects and benefits. So every medicine you would choose, you'd have to go through that discussion. The SSRIs, since I do treat many women with low libido, SSRIs are notorious for causing low libido and difficulty or inability to orgasm.
Yep.
So I try and shy away from those. But some women do best on those. Wellbutrin is an antidepressant that doesn't have sexual side effects, although sometimes it can make anxiety worse. So it kind of depends on the overall picture on if the woman has more anxiety or more depression. But yeah, SSRIs work, but they definitely have some other sexual side effects.
Yeah, we use the side effects of SSRIs to help men, certain men with premature ejaculation, because it's negative impacts on orgasm. What about let's switch gears and talk about the more interesting topic of sex with menopause.
So what I'll tell you about sex in general is that it's really an important topic. And our society really makes it hush-hush. Women aren't supposed to talk about it. There are not that many medicines that have been FDA approved for sexual problems in women. There are so many more medicines for men and their sexual problems. And, you hear about men's sexual problems. Men talk about sex that makes them, a stud and, macho. But women who talk about sex, no, women aren't supposed to like sex. And
well, thankfully, that double standard is going away, hopefully.
I hope so. Yeah. It has changed over the last 10 years. It has changed, which I think is for the better, because many women feel very broken, like something is very wrong with them, and they are too ashamed or too embarrassed or don't know who to ask. They don't know that there is a physician like me who treats female sexual problems. And it shouldn't be that way. If you have a medical issue, you should be able to get help without feeling embarrassed or ashamed.
You bet. And interestingly, Dr. Kelly Casperson is watching this live stream, and she is in on the West Coast, and she also deals with female sexual health. She actually started a podcast called "You Are Not Broken," addressing the specific topic of female sexual health. So what you said was just so timely. So that is a perfect segue. What about can you talk about your training as a female sex health expert?
Yes. So, when you're a resident, you don't get any training. We never talked about it in residency. And once I left residency and I went into private practice, women started asking me about low libido. And I was like, I'm not really sure what to tell you about that. And this was a long time ago now. A piece of mail came to my house about a conference about female sexual health. And I thought, this is it. I'm going to that. And I went to that, was up in Chicago. I learned so much. It was like opening the doors to a whole area of medicine that I had learned zero about. Even as a gynecologist, we don't talk about it. We didn't learn about it. And then as my practice grew up at the university and my partners knew that I took care of sexual problems, they started sending everybody to me. And I became known as the expert. And I was like, I better become the expert. So I found ISWISH, which is the International Society for the Study of Women's Sexual Health. They have classes or courses twice a year. I went to one of their courses. It was fantastic. I ended up doing a preceptorship with a physician in California in Laguna Beach, Dr. Critchman, where I got to be kind of like a medical student. I shadowed him in his office.
What a great opportunity.
It was fantastic. And actually, I'm from Los Angeles, so I got to go home and see my parents too. But I learned so much. And since then, I've just continued to educate myself. I'm, a big part of ISWISH. I'm on the board of directors of ISWISH now, and I'm the advocacy committee chairman. So I'm really trying to advocate for women's sexual health. But I'm self-taught because you really don't learn about it in residency or medical school. Unfortunately.
Yeah. I don't think it was kind of taboo during our training. And I think that topic is being broached and discussed a lot more out in the open. So that's a change for the better, for sure. Kind of like erectile dysfunction when Viagra came out. I think Bob Dole's one who was one of the guys who endorsed it and kind of brought it out of the closet. And so now guys ask for tadalafil and Cialis and Viagra like it's nothing now. So that's a nice change to have ISWISH. Believe it or not, I found out that one of my fellow urologist colleagues was attending ISWISH here in Scottsdale, and I actually
they do a course there.
Yeah, I actually crashed that meeting recently, and and that's how I learned about the female Viagra. Believe it or not.
Which isn't really Viagra.
No, it's not. It's not. Yeah, Vyleesi.
But that's the name the media gave it.
Yeah, Vyleesi and Abby. So there are now FDA-approved prescription medications to help women get in the mood.
Yes. So there's Addie and Vyleesi. And they're both great options for treatment for premenopausal women. They're not going to give women the sex drive of a 15-year-old boy. They're not, the magic answer to everything, but they definitely make women feel a little bit more sexy, a little bit more receptive to advances, more spontaneous sexual thoughts throughout the day. And I have to say, my patients, it doesn't work for everybody because nothing works for everybody, but the majority of my patients who are on them want to stay on them. Even though the change isn't huge, it's a small change that makes a huge difference in the relationship.
Boy, that's pretty exciting for women. That's for sure. Let's talk about, now you've been in academic practice for about 10 years, and you're making this big transition from academic medicine into the world of private practice. Not only that, it is concierge private practice, and you're about to open in about a week or so in Chesterfield, Missouri, right?
Yes.
So can you tell us what led to the change from academic medicine to concierge private practice? I have an idea, but you let me know.
I'll explain. Yeah. So, and I think this is true everywhere, not just academics, but a lot of practices, because reimbursement keeps going down, the way that practices stay afloat is with volume. And, I'm an employee at my academic institution, and I have a boss. And my boss says, see as many patients as possible in as short amount of time as possible. And that's not good, And on average, women have 7 minutes with their physician. That's it. And if you're thinking about sexual problems, 7 minutes isn't enough. And by the time you talk to a patient, you say, hey, how have you been doing? How's your family? Now you have 5 minutes. And it's really not enough. And so, I'm going from a practice with, over 4,000 patients to a practice where I have fewer patients, but I have plenty of time to talk to my patients, to get to know them. When they call the office, they don't get a call center where the person on the other end isn't a medical person and doesn't know them. When they call, they get me. And it's just convenient. It's easy. They don't have to go through a nurse to get their questions answered. I will call them back as soon as I get their lab results back. And I'm really excited about it because it's way better quality of care. Way better than that, short condensed visit where you can't be, I really want to be the best physician that I can be. And I can't do that in a 5-minute visit.
It's kind of like your, cattle call, the traditional medicine
it's
model.
It's not right. And I'm always double booked. And so I'm always behind, and then you're in a rush. And they've even done studies where they've looked at the quality of care that you get at the end of a physician's day compared to being the first appointment of the day. If you can swing it, you should always be the first appointment of the day, because the doctor's not as rushed. They're not behind. And those last visits, sometimes people are so behind, they tend to not ask a certain question or ask about a certain condition. So really the best care in the current system happens in the morning. But in my practice, it's going to happen all day long.
Wow, that is wonderful. And I've put the link to your new practice in the video description. It's Evora by Dr. Becky Lynn. And interestingly, my last name's Lynn and your last name is Lynn, but spelled differently. So that is just so serendipitous. Besides the voice and face-to-face interactions, are you offering any other remote consults?
Yes, absolutely. So right now I get consults from all over Southern Illinois and from all over Missouri, and people have to take a day off work. They have to drive up to St. Louis. They got to wait for a while, see me, drive home. And so I'm offering telehealth. So I only have a license to practice medicine in Missouri. So I can only do telehealth for residents of Missouri. I hope to expand that one day, because I think there are so many more women out there that need my services. But right now I offer telehealth, which is really good also because some people, they're embarrassed to call the office and say, hey, I have an orgasm problem. They don't want, it's an embarrassing thing. It may not be embarrassing for me to talk about, but for many women, it's quite embarrassing. So now they can talk to me in the privacy of their own home. I also do counseling, sexual counseling. And so that doesn't require exams. So that very much lends itself to telehealth. You can do that anywhere. For those of you outside of Missouri, for people who are outside of Missouri, I offer eHealth. And eHealth stands for education. And with that, I'm not your physician, but I can certainly talk to you about low libido and share my knowledge, what I know about, the treatment, the management, what causes it, things like that. And that I can do with anybody, anywhere in the world.
Sounds like a lot of promising and very progressive ways to treat women with their sexual health problems. And believe it or not, Medicare is slowly catching on. They are offering minuscule payment to telemedicine, telehealth, and e-health type of services.
Right.
So there is hope.
There is hope, but I'm not going to wait around for Medicare. So I just got to move ahead and help women today in the best way that I can.
Well, I want to thank you so much for spending time with us and sharing your wealth of knowledge about sexual health and menopause.
Yeah, well, thank you so much. I just want to add one thing. I also have a YouTube channel. So if you search Dr. Becky Lynn, I have plenty of videos about menopause, about sexual health, about sex after breast cancer. I have Facebook and Instagram, which are both at Becky K. Lynn, MD. And my Twitter handle is at Becky K. Lynn. And like you mentioned, Evora by Doctor, which is Dr. BeckyLynn.com.
Yep, I've already put that in the video description, so we got you covered there.
Thank you so much. I love talking about this stuff.
It's obvious that you're very, very passionate. So thank you again, and best of luck in your new practice.
Thanks a lot.
All right, that is it, guys. If you are feeling a little hot flashes, you may want to consider getting help with a gynecologist or a OB regarding your hormone levels. You may be going through menopause, and for guys, if your lady is complaining about hot flashes, seeing a physician may be the way to go. And thank you also so much for watching. Have a good day.